Hello, this is Wayne Brisbane, one of the authors for the AI-determined tumor volume to predict focal therapy outcomes, specifically in cryotherapy. So this is an explanation of how we determined the tumor volume, just a quick explainer video because it's moderately complex on paper, but I think a video will help a lot. So this is figure one, which we cited several times. This is a 50-year-old gentleman who initially was very interested in focal therapy. You can see his MRI target may be amenable to that. But because he was young, and for multiple reasons, his PSA density was quite high, we were quite suspicious that perhaps he was not a good candidate and ran this Unfold AI, which clearly demonstrated a high volume tumor. And so this would have been a good example where the MRI target clearly underestimated the volume of tumor. There's a couple of different boundaries, this moderate risk boundary and this high risk boundary, which are important for kind of delineating the tumor volume as best as we can approximate it. So what I wanted to do is show you the clinician-facing software and how this can be really done in real time. So this is what it looks like. So this is my clinician-facing software for this actual patient. And you can see here that this is kind of a three-dimensional volume that you can scroll through. So I'm trying to get it lined up like figure one is. And then this is a 3D volume that you can move around. And here's the apex, it's kind of lining those things up. You can see that the actual biopsy cores, which are showing in the top left portion of this screen, this is benign. This was grade group 2, this was grade group 1, and the AI takes in both the pathology, the tumor characteristics and location, and then obviously this region of interest, and note this region of interest is 0.4 cc's, okay? And then it expands that using the T2 weighted inputs, PSA and etc. To give you a tumor volume. Now you're going to have this on the clinician-facing software, this cancer encapsulation confidence score, and this is a percentage percentage confidence that you've encapsulated the entire tumor with this margin. And so obviously the red pixels are pretty high risk of cancer, but there should be some normal margin here, and this can be adjusted in real time. So you can see, like, you can adjust it, and these boxes will spin, and it's basically adjusting this. Now my encapsulation confidence score went up to 86%, but it obviously encapsulates a much larger portion of the prostate. In order to calculate the tumor volume, what we did is we brought this encapsulation confidence score almost down to 0%, basically all the way down till basically right here. And so this is going to be around 1 to 2%, so around that, and that is going to give you what we predicted to be the tumor volume. The idea here was you're basically just putting this ECS around the most red pixels. So this would be around 1%, or some fraction, 0 to 1%. And so you can see here that the lesion volume is going to be 8.6 cc's, much bigger than that ROI volume, and this was the number that we reported in the manuscript as the AI tumor volume, or just TV. So I hope that's helpful to help you understand exactly how we did this calculation. This can be done with the tool itself, just basically decreasing the encapsulation confidence score down to 0 to 1%. If you're wondering what 0 looks like, I'll show you. You basically scan it all the way down to there, and the encapsulation confidence score starts to come around the individual cores. So that's why we didn't go all the way to 0%. It's kind of like but less than 1 kind of percentage, but it's an attempt to encapsulate all these red pixels. Again, hope that's helpful, and I hope you enjoyed the manuscript.